As more vaping-related severe lung illnesses, cases, and deaths are reported, the national conversation continues to focus on the vaping public health crisis.
Dr. Ron Suprenant from the Buckeye Health Plan is here to talk about the importance of vaping, education, and prevention. It's great to see you again here, sir.
Great to see you.
You know, this is something that has really been in the news a lot lately, obviously the illnesses. So why is it important for this organization to really put a focus on it right now?
Buckeye Health Plan is committed to transforming the health of the community one person at a time, and that includes educating the community on important topics like this. So right now we're seeing a huge growth in the use of vaping devices and increased dangers being identified.
And we know that this epidemic is impacting people across the country, but if we're talking just about Ohioans, how is it affecting us here?
Actually, there have been many cases of new lung disorders associated with vaping. So these are serious acute lung disorders of hospitalized patients, and some people are even dying from this disorder. It's not well understood.
So as people are watching this right now, perhaps they use vaping devices. I mean, obviously they could just put them down, stop using them. For somebody who maybe doesn't partake in that, can they do anything to help with this, what is kind of turning into an epidemic a little bit? Yes,
well, it's very big, very popular among young people. So I think one of the things that people who are parents or who are grandparents who have young people in their family can do is they can talk to their children about the dangers of vaping. They can look for the devices, and these are a couple of examples of the devices that are very popular.
Yeah, it kind of looks like a pen.
This one looks like a pen, the other one looks like it could be a flash drive. So they're easily disguised. Parents may not notice them, teachers don't notice them, so they can be used in the schools and in the home surreptitiously. So keep your eye out for those, and if you identify those with your child, have a discussion about why they're using them and explain the dangers to them.
Yeah, and I know it can be probably an uncomfortable conversation. So, I mean, you mentioned talking about the dangers, but is there, a kind of a calm way to approach your child about it, not to sound very aggressive about it?
Absolutely, and I think that if you're really uncomfortable, that seeking advice from your family doctor or your child's doctor is a really good idea.
Right.
So the doctor can talk to your child for you if you'd like. The other thing we recommend is that parents avoid smoking and using vaping devices themselves as a good, setting a good example.
Yeah, role models.
Do you think it's safe to say that these are a little bit more addictive than what cigarettes? Obviously for the longest time, we heard about how dangerous and how bad cigarettes were for you. This kind of takes it to a new level. We know that they are bad for you, but also just the flavoring that you can have in an e-cigarette just makes it that much more tempting and addicting.
Well, the nicotine itself is what's addicting, and it is very addicting. It's actually considered one of the most addictive substances, more so than heroin, for example.
Really?
Wow.
I did not know that.
Yeah, they've done studies to show that, so it's quite interesting. People don't realize that.
Well, there's a lot more that people need to learn about vaping, and if you need any more information about it and the dangers, you can go to BuckeyeHealthPlan.com for much more. Always nice to see you. Thank you so much.
Great seeing you.
Thank you.